Welcome in the lesson 5 of the EFN Digital Skills for Nurses course. In this comprehensive lesson, we will dive deeper into providing information on the digital health coach. This lesson strongly aligns with Core Competency 5, which emphasizes the ability to independently offer advice, instruct, and support persons needing care and their caregivers. As a nurse, it's crucial to develop the capacity to provide precise guidance to your patients regarding the digital health. As indicated in the guidelines on prevention developed in the Answer for Care project, technological innovation can lead to new and changing roles for nurses and social workers, for example as health coaches, and should form an essential part of any competency framework for initial and continuing professional education. Digitalization is part of our daily routine, and we can affirm that technology is transforming every aspect of our life. In this context, it is essential to involve the healthcare sector in this change, in order to embrace technological innovation to empower citizens and healthcare professionals to promote health and well-being and ensure the delivery of appropriate, cost-effective care with improved outcomes. Of course, to make it happen, it is fundamental to engage the principal stakeholders, patients and healthcare professionals. According to the evidence, nurses are uniquely placed to act as a health coach and to help prevent non-communicable diseases by supporting healthy lifestyles. In this regard, invest more in the role of nursing for reshaping the healthcare systems is a key initial step forward. Nurses are the closest healthcare professional to patients, able to influence citizens, patients, and their families. Investing more in the new knowledge and skills for nurses means improving the entire healthcare system. This central role of nurses was explored in the Answer for Care project, which provides examples of how individual nurses and social workers can use internet-based technology to promote healthy lifestyles. A number of evidence-based guidelines for nurses deploying e-health services was published after the project. An example on how nurses have a coaching role that can be fully digitalized is the recommendations for promoting a healthy lifestyle. This is a part of the nurse's daily task and competencies. Examples for healthy lifestyles are promoting exercise, healthy eating with more fruit and vegetables, less fat, limited use of salt, alcohol stop, and quitting smoking plays an important role in handling and limiting NCDC. These recommendations for healthy lifestyle are very important for patients with myocardial infarction, heart failure, chronic pulmonary disease. Another example can be that one of oncology. The oncology nurse is a coach who assists cancer patients with advice throughout the entire treatment process. The goal for chemotherapy is to cure, sometimes control, and in some cases palliative care. The support can vary based on each individual needs. Besides administering the chemotherapy drugs, the nurse will educate patients, managing side effects and supporting patients and their families emotionally. The patient with cancer and their relatives have so many questions. Listening to their questions, providing advice and guidance makes a world of difference for them. In this reality, even more digitized, it is key to improve the nursing workforce digital knowledge and skills in order to reduce the currently existing gap between digital technology trends and their effective use for direct patient care, especially for patients with multiple chronic disease. From an EFN perspective, it is important to recognize the key role of nurses in the design and the deployment of virtual digital coaching. For nurses active in public health, the virtual or digital coach will be perceived as a support, as it will understand and learn about the individual and provide behavioral coaching in near real time. It is important to invest in public health, primary care prevention and community care. As we all know, new technologies and innovation is changing and transforming every aspect of our life. In this regard, it is very important that nurses, healthcare professionals and all those involved in the health embrace technological innovation to empower citizens and healthcare professionals to promote health and well-being. To make it happen, it is important to provide nurses the right skills and knowledge in order to add value in their use with citizens. With the right knowledge, skills and support, nurses and citizens can use digital technologies to achieve transformational progress in health promotion and disease prevention. Thank you all for following the lesson 5 and see you in lesson 6, which will focus on resilience and crisis management.